Do I need to start MDS treatment right away?
Here again, you can split all MDS patients into low risk and into high risk. Okay, so the way we think about low and high risk is that high risk patients, biggest worry we have is that MDS now becoming acute leukemia, and that leukemia can be lethal, right? And so that's the major problem. With low risk MDS, what you see are you see people with low blood counts, right? They could have anemia, they could have low platelets, right, that cause bleeding, or anemia that causes fatigue. And so there, patients might live for a long time with those conditions. And so a portion of those patients we would not treat unless their anemia was symptomatic or their blood count issue was symptomatic, right? Because if it's not symptomatic, then the patient is asymptomatic, and any treatment you give them can potentially cause symptoms, right? So what we want to do is we want to maximize in low-risk patients the quality of life, right? So the things that impinge upon that are the symptoms you have from your blood counts being low, the need to get a transfusion frequently, that's oftentimes a problem. And so we balance out, does the patient really need treatment like a transfusion right now? Or can we know that they have MDS, but they might be fine, so we might just wait and not treat them at all.
How do I become more knowledgeable about MDS?
Studies have shown that educated and empowered patients often have better outcomes. HealthTree University is the first and only free, comprehensive curriculum for patients and caregivers. Create a free account to gain exclusive access, where you can watch our newest unreleased videos, easily explore topics through our organized courses, and assess your knowledge with interactive quizzes. Visit HealthTree University and become an empowered patient today.
Starting treatment right away is necessary for certain patients with MDS who have a more aggressive type of MDS, but for other patients who have a less aggressive type of MDS, a lot of them don't need to start treatment right away and can just be can be monitored carefully. Some patients with MDS need to start treatment earlier, while some patients with MDS can be closely monitored without the need to start treatment. This applies for patients with MDS who have both lower risk and higher risk MDS. Lower risk MDS is when we have a failure in the bone marrow, and so patients have low blood counts, which can be low red blood cell counts or low platelet counts or low white blood cell counts. Some of these lower risk patients can be safely monitored and watched without needing to start treatment. The treatment options for these lower risk patients with MDS include erythropoietin stimulating agents, or ESAs, we call Retacrit or Aranesp, and then that's to help improve the hemoglobin. There's newer drugs available, including luspatercept or Reblozyl, which can be given to a special subset of patients with MDS who are lower risk, some needing transfusions, some not needing transfusions. And then there are other drugs that aren't currently approved, but that are still in use to try and boost the white blood cell count and the platelet count. So we typically only start treatment for our lower risk MDS patients when they need to start treatment, when they have symptomatic effects from their MDS. For higher risk patients, we typically need to start treatment sooner than later because we're concerned about a progression of their MDS to leukemia. So in those patients, we tend not to try and wait a lot of time, and we try and start treatment sooner, which usually involves a hypomethylating agent, which can be azacitidine or decitabine, or a new pill called Inqovi, which is an oral form of decitabine.